So the compassionate care and counseling in GI and liver diseases. Let's see some examples. Avoid medical jargon. Empathy in action. Use words and tone that show understanding. Use open-ended questions. For example, what concerns you most today? Reflect feelings. For example, you say, it sounds like this has been really tough for you. And validate emotional reactions by saying, for example, it's understandable to feel this way. You should use patient-centered language. Avoid saying fatty liver due to bad lifestyle. Say, your liver has accumulated fat and we can reverse it with the right steps. Shared decision making. For example, you say, what's important to you as we move forward? It should be having motivational interviewing. Guide the patient, don't push the patient. Help patients explore their own reasons to change. So let's take an example of irritable bowel syndrome. Clinical scenario: a young woman with IBS complains of daily bloating, discomfort, and unpredictable bowel habits. She has been told by others, it's all in your head. So the compassionate response by you in such scenario can be, acknowledge her suffering by saying, I believe you. What you are experiencing is real and painful. Offer reassurance by saying this is a manageable condition and you are not alone. Discuss a step-by-step plan, diet changes, stress management, and possible medications. Encourage her to keep a symptom diary to feel more in control. Another example, inflammatory bowel disease. Clinical scenario: a young man with Crohn's disease fears social embarrassment due to urgency and bowel frequency. Your compassionate response in this scenario may be, validate his concerns by saying, many patients feel anxious in public due to these symptoms. You are not alone. Discuss practical tips, toilet access, diet planning, and emergency kits. Offer psychological support for anxiety or depression. And involve patient in shared decision making about medications or surgery. Let's go to another example, the most common one, the fatty liver disease, MESL and MASH. Clinical scenario, for example, a middle-aged man with MASH is struggling to lose weight. He feels ashamed and frustrated. So your compassionate response in such case may be, avoid blame. This is not about willpower. You can say this. Many factors influence weight and liver health. Avoid shaming language. Instead of, you need to lose weight, say, let's work together to make small changes that protect your liver. Provide hope by saying even modest weight loss, just 5 to 10%, can improve your liver significantly. And involve a nutritionist and create realistic goals together. Ask about stressors at home or work that may be affecting self-care. Another example we daily come across is the chronic hepatitis B and C. Clinical scenario: woman with newly diagnosed hepatitis B feels scared, isolated, and afraid of infecting her family. Your compassionate response in such scenario should be normalize the conversation by saying, "You are not alone. Millions live healthy lives with treatment." Reassure them about transmission and safety. You can hug, share meals, and be with your family. Provide emotional reassurance. You can live a long, healthy life with the right care. And gently correct misconceptions, explain how it spreads, how to protect family, and dispel stigma. Ensure follow-ups for antiviral therapy and monitoring. Link her with support group or community resources. Then another disease you may come across is the alcohol-related liver disease. A clinical scenario: a man with cirrhosis due to alcohol is in denial and feels judged by family and doctors. Compassionate care in such scenario: use non-judgmental language. Let's focus on helping your liver recover. Stopping alcohol is the first step, and we are here to support you. Offer referral to addiction counseling or support groups. Show respect and avoid shame-based conversations. Reinforce small wins. I'm proud of the effort you are making. You can say this. Then another scenario in GI is the compensated liver cirrhosis. Clinical scenario: a patient newly diagnosed with liver cirrhosis is scared and confused. Your compassionate response in such scenario: sit with the patient and explain the condition calmly. Answer all questions without rushing. Acknowledges his fear. Ensure a follow-up plan with a dietitian and counselor. The patient leaves feeling informed, support, and hopeful. Now the scenario of a decompensated liver cirrhosis. A patient with decompensated liver cirrhosis struggle with cognition, poor memory, lack of concentration, and frequent loss of temper, resulting in shame and family tension. Of course, he is in hepatic encephalopathy. So the compassionate response in such case may be: speak slowly and reassure. For example, you say you feel foggy sometimes. That's from toxins your liver cannot filter well. We can manage this. Encourage family involvement and train them on medication, schedules, signs of confusion, and diet. Offer caregiver support. It reduces burnout and improves patient outcomes. Another scenario, an elderly patient with end-stage liver disease is told he is not a transplant candidate. So a compassionate response in such case, speak gently and clearly. We can't offer a transplant, but we will never stop caring for you. Discuss palliative options to manage pain, ascites, or encephalopathy. Involve family early in care planning. Provide dignity, presence, and space for spiritual or emotional conversations. Another scenario, a patient with decompensated liver cirrhosis has been diagnosed with vaso-invasive multifocal HCC. Your compassionate response in such scenario may be, we know this is a moment for deep human connection. Listen with heart and speak with honesty. Be gentle but truthful by saying, we can't cure this, but we can care for you in every way possible. Explore what matters most to the patient: family, faith, and comfort. Involve palliative care early, not just in final days. Document wishes clearly. Advanced directives: do not resuscitate, that is the DNR orders, pain management.